Okay, so my comments will be relatively, I don't have slides, but my comments will be relatively brief, in part because in fulfilling a role for the NIH as the Associate Director for Data Science, I've only been doing this for this is my 9th week, I think. But I'm highly relieved to see my colleague Kathy Hudson sitting here in the audience, who should be the one sitting here, and we should probably change roles, but I'm sure together we can be helpful, I hope. So I can't. Prior to that, I was actually at UC, the University of California, San Diego, where I was kind of on the other side of data in a sense, more not particularly the regulatory side, but essentially responsible for managing data. And I have to say also my experience is very much with basic data rather than clinical data, and certainly clinical trials data. So I'm not, for that reason, I won't say very much. But I will say a few things because I think they translate into how it applies to clinical trials data, and how at least some background thinking that should go into that, into how that kind of data is regulated and controlled, and the governance model for it. So I would say that, in generally speaking, and I'm sort of shooting my own self in the foot by saying this now, but I think the federal oversight of various types of scientific data have been less than satisfactory. And, you know, I think that's in part, well, I guess we're here, but certainly what's sort of happened in contrast to that is, in many ways, the community has sort of come to the rescue. And I think now the roles are beginning to reverse a bit, and I think that's an exciting time, and one of the reasons why I was happy to go to the NIH. But an example of sort of where the community has come in is, I think, as Bartha has said, the Global Alliance for Genomic Health is an example of a community-based effort that's, broadly speaking, I think has the opportunity to have very significant impact. My own experience has been on other community efforts where those communities effectively pushed I guess, the scientific process into providing the kind of access that was needed for data. So, for example, I was associated with the Protein Data Bank for many years, and in that case, that community actually en masse pushed all publishers not to accept papers from that community unless the data was actually publicly accessible. And that had a profound impact on the community and what's happened subsequently. That also led to an organization called the Worldwide Protein Data Bank. So even though the data was managed and essentially funded by independent national entities, the consortium actually came together, so the scientists came together under that umbrella to actually operate, even though they were funded separately. And I think it's rather disappointing that we don't have more. There are a few instances, of course, that we don't have more international funding to support these kinds of initiatives. How these communities that maintain the data in this way flourish, I think, is an interesting question. And I don't think this is something that has been studied enough, and the Global Alliance would be interesting to see how that evolves. For my own thought process, I would say it happens very much by, success will come very much by inclusion, so being very inclusive in the process. And as it evolves, by being inclusive, a certain level of trust emerges, trust in whatever it is, in this case, clinical data that would be maintained by such entities. And I think that is you know, extremely important, and I compare trust to sort of a compound interest. It builds over time, and as time goes by, it gets more and more, but there can always be a drop in the market, and you can essentially lose it overnight if things aren't dealt with properly. With respect to what the NIH is doing directly, I mean, we're gradually moving towards more data sharing plans that have, you know, in compliance with the Holden Memorandum, and then even beyond that. So I think we're going to see increasingly sort of detailed and plans and requirements that I think it will take us to a new place. The first one that will appear is not specifically around clinical trials data, but it's around genomic information in general. And that has been through a whole process whereby it was, there was a request for information from the community that led to a proposal for what this should look like, which was then further vetted by the community. Again, this sort of community building kind of thing, which would seem important. That's now led to a draft proposal, which is in its final stages. And that then will take effect probably some point in the new year. And so it's one of a number of steps, I think, towards data sharing plans which will lead to more responsible sharing. I would like to see the plans that already exist, I think, are not particularly well enforced. And I think the idea that we move to better regulation of those plans is something that I personally would like to see very much. And I think that can happen by virtue of the plans themselves being somewhat more machine readable, so that indeed elements of those plans can then be reviewed against where data is in fact made accessible. And so that there can be some automated checking. I think if without automated checking, putting teeth into data sharing plans becomes rather difficult. So, but there's less and less impediment for that to happen. And I think at the same time there needs to be significant oversight and more consideration of metrics for how this data are being used, and that in a sense should drive how we think about the responsible sharing. And right now it seems that effectively all data is created equal, and we're in a completely unsustainable situation. So I think we have to really begin to look at how data are being utilized. We need new metrics for that. The current requirements from most federal agencies around how data are being used are actually quite inadequate. They essentially speak to things like number of users, amount downloaded, perhaps some level of demographics, but exactly how those data are being used at the atomic level of that data is not really explored, and that really is something that is definitely needed. So I think that's all part of a strategy for responsible sharing. So I'll stop there.